Today we're going to talk about crisis counseling and critical incident management in schools. So what we know is that there are increasing concerns in the school setting related to violence, at-risk behaviors, and mental health issues that may be presented by students, staff, or even parents. And we know that schools are more and more being called upon to respond in some manner to these situations and incidents. It's important for a school system to have a system in place so that when an event happens, you have a plan for how you're going to efficiently and effectively respond to the situation. Um, if you're having to make decisions on the fly about what are we going to do about this, then you're more than likely not going to have an as effective of a response. If you kind of think about it like a fire drill, that we practice a fire drill in the event that there's a fire, and so we all know how to exit the building. We know how to sweep the building to see if there's anybody left behind. So crises are in the same situation. That at a time of high stress, um, emotions may be high, adrenaline may be high, and we may not be thinking as clearly and logically, and we may miss something. We may let something slip through the cracks. So when we look at a crisis, the definition of a crisis is that when an individual or group is faced with a problem that they're unable to resolve immediately. And within that, there's different classifications of crises. So you can have a developmental crisis. A developmental crisis is when you just have naturally occurring events that are related to growth and development, and you don't respond well to that. Sometimes that's related to transition. So for kids, it could be transitioning from one grade level to the next, from one building to the next. Um, I have seen a couple of first graders who did not transition well from kindergarten, and that was in a situation where kindergarten was a half a day, and when they got to first grade, they had to go to school all day, and that the structure of first grade was a little bit different, and that some of them didn't transition to that well. You see situations of students not transitioning from elementary to junior high or junior high to high school well. In some situations, you have students that don't transition well into just growing up. For girls, if going into puberty or starting their first period, that if they've not been well prepared for that, then you may see an individual crisis occur with that. A situational crisis is something that's unpredictable, unexpected, and beyond your control. So that could be an accident, a suicide, a crime, a fire, an unexpected death of some sort. Uh, an existential crisis has to do with having this conflict with purpose and responsibility. So it could be that you don't adjust to leaving home and going to college well, or an unexpected pregnancy. Um, and then an environmental crisis would be some type of natural disaster, a hurricane, earthquake, a flood. We've seen a lot of that in the news recently. So we know that there is a need for some type of intervention model. Crises are normally time limited. They require some type of immediate assistance, and the purpose of that assistance is to minimize the immediate level of distress and contain it to the people that are affected, to hasten the resolution, and to assist in getting things back to some sense of normalcy as quickly and efficiently as possible. So, recognizing that for some of the individuals involved in a crisis, normal may not look the same as it did before, but to help them move to a place where they're able to function in the school setting again as quickly as possible. So the model of crisis intervention that we're going to look at has 3 stages. So you have assessment, intervention, and follow-up. In the assessment, you're assessing what has happened with the crisis, and the impact of that crisis. It's usually pretty action oriented and pretty time limited. You want to know, the severity of the crisis, who is affected, Was it just an individual? Is it a group? Is it school-wide? If it's an individual, it's unlikely that you're going to have to really engage in much more than just a counselor to student or whoever it is that you're dealing with. That it's not going to have to be a system-wide approach or a greater approach. If it's a group, obviously you're going to have a little bit higher level of intervention, and if it's school-wide, it's going to be even more, a broader level of intervention. So then you want to look at to what extent are these individuals affected. How significant is the distress that they are under at the time? So let me give you a couple of situations. Let's say that you've had the death of a teacher. Okay, the first situation would be a teacher who, let's say, has been sick. They have cancer, and they've been sick for quite a while. That everybody has had time to adjust to the fact that the death is imminent, or that it's inevitable. Maybe the teacher's been out for several months and you've been getting updated reports that they're not doing well. A week ago hospice was called in, so you've had the chance to prepare individuals for that upcoming loss. That's not going to have the same impact as a teacher who is killed in a car accident all the way to school. That's going to have a greater impact because you've had no way to prepare for that. So when you're looking at this, you want to observe what we call the ABC model. So that's the affect. How are people feeling? And affect is what you observe. So, what are your observations about the way people appear to be feeling? What behaviors are they exhibiting? And then their cognitions. What are they thinking about the situation? So in determining the severity, you also have to assess the balancing factors that may provide us some protective factors. So, let's go back to our teacher example, the perception of the perception of the event. In the situation with the teacher being ill, that the perception could be that they're not suffering anymore, that it's they've the end of the illness is over, whereas in the accident on the way to school, that this is unfair, life's not fair, that type of thing. So what's the perception of what has occurred, and then what's the level of support that the individuals involved have, and what are their existing coping skills? So then when you look at the interventions are the strategies designed to contain the crisis. Especially in a high school setting, a lot of times you will see it's a contagion, and you'll see students react in a way that seems to be a little exaggerated based upon what you believe their relationship with the situation is. So, when you have a student in school die, that a lot of times everybody has become their best friend at that point. And it really, we tend to think that kids are doing things like this for attention, and more than anything, it's about coming to the reality of their own vulnerability and their own mortality issues. So you want to be able to, when you contain this crisis, you want to identify the people who are really significantly affected, and in some ways kind of separate them from those who are not, so as not to escalate some of that behavior already. So then you have different levels of intervention based upon your previous assessment. You decide who needs what level of support, and are there some that we may just need to refer out. Follow-up is what typically is the thing that's left off most often, that once things kind of tend to return to some sense of normalcy, that we just think it's over and we move on. So you want to be sure that you have built into your intervention model a continuing system for monitoring what's going on. And to be able to provide individual and group support. Monitoring the anniversary dates when you're monitoring are really, really important. You want to look at, a month out, 6 months out, a year out. Anniversary dates can be a, a really at risk time for some individuals. Uh, some will tell you that, part of that has to do with some body memory and some uh, that trauma is stored in our cells, and that whether we recognize things or not, we're consciously aware of anniversary dates, that a lot of times there's a subconscious level of knowledge related to that. When I was a freshman in college, one of the guys that I went to high school with committed suicide. And a year later, on the anniversary date, his little brother committed suicide in exactly the same manner. So you really want to pay particularly close attention to siblings, close friends around those anniversary dates, and just be sure that you're checking in with them and monitoring what's going on with them. And so obviously, you can't just leave it up to remembering, oh yeah, a year has passed. You want to put some dates in your calendar and reminders to check up on some of those things. So a school should have a crisis response plan. And some schools are really resistant to do this, and they just, let's pretend nothing happened and go on with a business as usual approach. When you don't have a plan in place, typically you have an inadequate and or ineffective response. Most schools do not have a detailed plan or policies or procedures for dealing with a crisis, and you want to have that plan to include particular crisis. This is what we do, in the event of a death. This is what we do in the event of a natural disaster. This is what we do in the event of, an intruder on the campus, so that you have things really clearly lined out as to what that response is going to be. For some schools that do have a plan, they're outdated, that they have not gone through and looked at, what's changed since that. So many your plans need to be revisited and revised on a regular basis. When you're writing a plan, and we'll talk about this maybe a little bit later. You never want to put somebody's name in there, because if that person leaves 10 years from now, if this plan's not updated and it says, Leanne Salmonson's going to do this, people are going to go, who is Leanne Salmonson and what did she do? So who's supposed to take that? So you would put, school counselor will do this, assistant principal, nurse. So you identify roles and not particular names. So in developing this crisis response plan, they should be developed at the individual school level, and counselors should take the lead in developing the plan. Now, in the event that it's a school security issue, like, a shooter on campus or an intruder on campus, that administrators may take the role in that. But when you're talking about how to respond from an emotional and psychological standpoint, the counselor should take the lead in that. And when you do this plan, you should encourage wide ownership, lots of people involved. And your plan needs to be very specific and very prescriptive. So again, when things are stressful and emotional, that you don't have to stop and think. One of the things about having to lead the crisis response plan or the crisis response team is, as a counselor, you will have an emotional response to what's going on. I've lost several students, and that's a difficult place to be as a counselor. I've lost colleagues, and that's a difficult place to be. But as the counselor, you have to keep your emotions in check, so that you can be responsible for carrying out the duties that you need to carry out. And then you need to have the place where you can go and kind of process your own stuff and then come back to the responsibilities that you have. One size fits all plans do not work. It's the and this can be at the district level, that sometimes that you'll have a district level crisis response team. And so in that, if the district level crisis response team is enacted, that they come in and they kind of take over your school. And I've been in that situation before, where we had a student who died of a drug overdose, and the district level team came in, and everything that I'm saying here happened in our school. The people who were involved did not know our students. The students didn't know the people that were coming in. My role as a school counselor was usurped in I knew my students, I knew the culture of my school, and so the response is also then not coordinated with other elements of your counseling program, and then the follow-up and ongoing intervention is not real effective. Now, that doesn't mean that you can't bring in outside people for assistance, but those people don't need to be directing the response. I have been called in several situations to a campus where there's been a death, and so they call in area counselors to come in and be available. And my experience, not only on my own campus but on other campuses, is that students do not want to talk to adults they don't know. They want to talk to the adults that they do know. And a lot of times the individuals that they have the closest relationship with are teachers. And if your teachers are trained on how to respond to this, then they can handle all of that. I know in the situations when I've been called into a campus that I was not a part of that campus, students did not come to us for help. Now, several of the adults did. So, the teachers may have stepped out and come and talked to the outside counselors. And our job was to kind of help them process their emotions and send them back in so that they could be there and be supportive to the students. But it's kind of like a family coming together. If you have a family member who dies, you don't want strangers coming into your house and comforting you and helping you work through that. You want people that love you and that care about you and that you have a relationship with, and you want to draw together in your shared grief of that. So that's why we should really work to not support a district level team. Now, again, it's different if you have some type of security crisis that you would want other people coming in, but that's a safety and security issue, not an emotional response. So in looking at the campus level plans, we have personnel at the campus, or they know their students, they're better able to address the campus needs. The counselor should be central in planning the crisis response. They should work closely with the administrator, but the counselor should take the lead. The administrators a lot of times are the ones that say, let's just not make a big deal about this. Let's just let things go, because they're afraid of the emotional response that may happen. So when you're developing your plan, you want stakeholders involved, and so you would develop a crisis response planning committee that would include your counselor, your administrator, if you have a school psychologist, teachers, nurse, maybe central office personnel, counselors from outside agencies. If you're in a small community, you may want to look at who are some people in your community that would be of support to you and that would be of support to the students during that time. And then once the plan is developed, you want to get feedback from your school attorney and the school board. Again, your plans should be very specific and describe a structured response. Your procedures should be clear, and information needed for an actual response must be included, and details of the plan assist they help you when you're affected by the crisis, as I talked about before, that when you're having an emotional response to the crisis as well, that you've already thought through things and it's well laid out and you know how to respond to that. So on your questions to answer as you're setting up this team, so who is on the core team? Who composes the response team? What are the responsibilities of the core team members? So these are some examples of individuals. A school crisis response coordinator, that could be your principal or your designee. The crisis intervention coordinator, that should always be the counselor. Obviously, your nurse is going to take care of any medical or health issues. The assistant principal may be the coordinator of security and safety issues. Uh, Often, if there's any media management involved, that's a district level personnel. Here's the best tip I'm going to give you in all of your master's degree: do not talk to the media unless you have your administrator's approval. That if there's media that comes in, that you direct them to your administrator, and your administrator may direct them to a district level. That would be up to them. And then one of the things that is often left out is the debriefing process. So that after the crisis is over, that you have a coordinator, and that can be your administrator or a counselor, and that kind of debriefs about how did everything go? Is there anything that we need to change in the plan? Did we find something that didn't work? What worked exceptionally well? How are the response team members doing? Um, so checking in on them as well. And it may be that you bring in an outside mental health professional to assist with the core team members. That's that safe place for your core team members to go, and your intervention response folks to go to kind of process their emotions. So the responsibilities of the response team is to provide direct services to the students. You want to talk about what are the communication procedures? How's the core team member? How are they going to communicate? Who's going to be the first person notified in the event of a crisis? Uh, and how does that person communicate with the other people? How will the core team, which again is probably going to be your principal, the counselor, your lead people, um, how will they respond to the response team, which may be outside counselors, that may be your teachers, uh, and then how are you going to communicate to students, staff, parents, and others outside of the school? Um, Typically, if there is any way, let's say that some type of crisis has occurred over the weekend or overnight, if there's any way that you can let teachers know before they show up on campus, that's going to be the ideal situation. If you can get teachers on campus a little bit early, and that there can be a quick meeting in the morning to talk about what's happened, and to remind people about their responsibilities, and how to intervene and how to respond, that will be important as well if you can make that happen. Training is crucial. So this kind of goes back to what I was talking about before. You want your core team to be trained, you want your response team to be trained, you want teachers and staff to be trained. And in training with your response team, which may include your teachers and staff, you want to be sure that you've basically, what you want to do is train them in psychological first aid. And so to talk to them about how do you respond in a crisis. And psychological first aid is really about just talking to people about, what do you need from me right now? How can I be here with you? How can I support you through this process? When you do that, you want to be sure that you've given some do's and don'ts on how to respond. Uh, you you don't want to say things, like they've gone to a better place. Um, God needed them more than we needed them. God's plan is greater. So you have to be careful in those types of responses, and the types of things that you say, because you can actually, especially for kids, you can make things worse. You never say that things that they've passed away, that an eternal sleep. those types of things. Because for little kids, you can make them really like, what if God wants me to be his angel? Um, I don't want to go to sleep because if I've gone to sleep, what if I'm don't wake up? So you don't want to use euphemisms. You want to say the individual died. Use the term as it is. Um, and then how are you going to training for your students, especially if it is like a security crisis? You want to make sure that you've had drills in your school so that your kids know, that if there's a lockdown, where do they go? What do they do? And then you want to train your parents in these situations. This is how we will communicate with you. This is how we will respond to you, especially if it's like a lockdown situation. You want parents to know you will not be allowed to come on campus and take your child. We can't open the door to let you into the building for fear that somebody else could get into the building. So you want to help them to understand that as scary as it is for a parent for safety and security reasons, everything has to be held in place as it is, and you can't start releasing kids. In the event of some type, let's say a death or some other type of natural disaster, for parents to understand children or students are not going to be released unless they're going home where there's an adult present. That if my best friend was killed in a car accident on the way to school, you don't want to send me home to be home by myself. So I'm better off at school, and even if it means that we're gonna find a place for me to stay. I'm gonna be in the counselor's office. I'm gonna be in the nurse's office. We're gonna have a room set up for the kids who are the most severely affected by this crisis. But that you want to be sure that an adult is responsible for the students. So, some specific implementation guidelines. A general assembly of students is not recommended. You do not call the entire student body together to give them the details. That's just asking for an escalation of, of emotions. Um, you can, and you, as far as providing notification, there are a couple of different ways that you can do this. If you have everybody in a classroom, you can do an overhead announcement. It's probably not the most appropriate thing to do, but you want to make sure that everybody gets the same message. So you can do an overhead announcement. Um, you could type out a script for teachers to read in the classroom. In doing that, you want to provide the facts only. You don't embellish the story, and you don't escalate emotional response. You don't want to dismiss school and isolate students. Allow students the time to grieve. You need to, allow for excused absences for funerals. Even if you don't feel like that child is particularly close, if it's important to them to be there, you want to honor that. Uh, Listen to the students. They'll tell you what they need. A lot of times they just need to talk. Don't force counseling on students. If there are siblings or relatives or friends in other schools, you may want to notify them. Consider the effect of the crisis on parents and offer some support. Several years ago, I was providing school counseling services to the charter school at SFA, and our early childhood program over there, the early childhood lab, there was a little girl who was 3, and her family was at their farm, and she was accidentally shot, and her father accidentally shot her, and she died. And so I went in and worked with the 3-year-olds, but one of the things we did that evening, or late that afternoon, was we had a meeting for parents, for them to come up, and obviously for any parent who has a, when you know a child that dies, it affects you, even if it's like, oh my gosh, that could have been my child. um, but we provided some support as to how to talk to their kids about the situation and how to handle questions. Should they go to the funeral, should they not go to the funeral, those types of things. You want to work closely with any type of organizations outside the school setting that provide support. So you may want to think about especially in a small town or a small community, youth directors at local churches. Are there coaches like that have a good relationship with students, and consider whether you want to allow those individuals to come into campus. If it's a situation with a youth director or a pastor, anything with a religious organization, you need to make it clear that they can come up and they can meet with the students that attend their church, but they can't meet with it can't be like general. You would, and that's a parental thing. If the students are going to a particular youth organization, then they have parent support for attending there. And so you would assume that the parents would be supportive of the philosophy or the values that would be utilized with that. Um, but they can't just talk to any kids, because then you may end up with some values conflicts. You want to avoid any type of practice or activity that may exacerbate the crisis or glorifies the problematic behavior. This is really, really tough. And you want to absolutely make sure that you have school policy in place before you have a crisis related to this. So you do not want to do any type of campus memorial for a student who died as a result of engaging in risk-taking behavior. So drinking and driving, doing drugs, a student who committed suicide. You don't plant a tree, you don't put a plaque up, because at the developmental level of students, it's like, oh wow, look, they have their own plaque, they have their own tree. They dedicated the baseball field to this student, because you never know when kids may go, I want people to remember me forever like that too, and then engage in the same type of behavior. So it's very important that you have that policy in place. That includes like memorial pages in a yearbook. Now, if you have a student who dies of an illness, that's different. Right? But you want that policy to be in place so that in the event that a parent or a group wants to do something like that, that the policy is already in place and you can say, I'm sorry, here's the policy. But when you say, I'm sorry, here's the policy, you need to do it with compassion and help them to understand why, and that research supports that. So when you're engaging in the crisis counseling, not all crises warrant the school's crisis response team. If it's a small group, then you deal with the small group. And you just, an individual or small group, the counselor can handle that. I had, at our high school, we had an advisory program, and so students were in this, it was called family, and they were assigned to a family when they first enrolled in the school, and you stayed with the same family throughout your time there. So it was multiple grades. And you had a couple of school facilitators. We called our teachers facilitators. You had 2 family facilitators that became your advisors. But in 1 year, I had 3 students in the same family that lost a parent. 2 of them were unexpected, both heart issues, and 1 had cancer. So in that we responded, we didn't need a school-wide response. Obviously the child who lost their parent needed the support, and then we worked with that family, the advisory family, because they were a close group of kids, and especially after the 3rd parent in the same family, each one became a little bit more significant of a crisis. One of the things that I typically do if we've had a student that has experienced a loss of some sort, I like to meet with those kids before they return to campus and have a conversation with them about what do you need from us and how do you want people to respond to you. Do you want people to just act like nothing has happened? Are you okay with people, offering their support and sympathy to you? How do you want us to handle that? And some of them, they really did want to be treated like nothing had happened. And there's two issues with that. Number one is that coming to school, they're just trying to keep their emotions intact. and they don't want to have an emotional response at school. And if somebody is offering sympathy to them, if somebody's being, kind and supportive, they're afraid that they're going to break down and cry at school, and so they don't want that to happen. And the other thing is, it's pretty common, especially with kids and adolescents, to want things to be as normal as possible wherever it can be. My whole life has just been turned upside down. So if school's the place that things can be normal, that's what I want, because that gives me that sense of security. So then I would go back in to their friends, at the high school level, to their family, to their classes. I would go to all their classes, and would talk to them about, I've met with them, this is what they want, and this is what they're comfortable with. And then talk with the kids too about, how do you respond to stuff like this? Because, it's an uncomfortable situation for students, and sometimes they don't know how to respond appropriately. And so we talk about, what are the types of things that you can say to somebody who's lost a parent, or, has just found out that they're really sick, whatever the situation is. So you help prepare them so that they can be of support. Um, if the situation is pretty intense, then you may want to refer out. Um, and so you would want to have a referral list of who you could refer out to. So, general principles for crisis counseling, for how to respond: you want to respond immediately. You want to be directive at first if it's necessary to ensure safety or contain the crisis. You want to be concerned and competent. Pay close attention to the feelings that are being expressed. Get the facts surrounding the crisis so you can be sure that that people are dealing with the facts, and that you shut down any type of rumors or conjecture that was going on. You want to be sure that you sustained relationships outside of your school setting and use the resources. Help the students confront the reality of what has happened. Um, and, sometimes in shock that we deny things, and so you want to in a loving and supporting and compassionate way, help them face the reality of them. Don't support blaming. One of my graduates was a counselor at Palestine High School, and there was a car accident. There were 4 kids that were in the car, and the driver was the only one that survived. The other 3 students died in the car accident. And so when he came back to school, the students were just awful to him and blamed him, called him a murderer, told him he was a killer, all this stuff. And so you don't want to be in a situation where you allow that type of thing to happen. The kid ended up having to change schools. You expand the student's time perspective. So what's that means is that this feels awful right now, but next week things are going to be better. The week after that, you're going to continue to get better and better as you adjust to this, as you process your feelings. Don't offer any false reassurance or generate any rational hope. Or you want to generate rational hope. So let's say the situation of somebody's critically injured and it's, life or death situation. You don't want to make the students believe that it may be okay. You can say things like, we're going to hope for the best, that we're going to offer our thoughts and prayers to this individual, but we don't know what's going to happen. This could not turn out well, or this could not turn out well. Help students take some type of action. So if it is in writing cards, sending a note to the family, doing, some type of thing where they can offer their well wishes or their thoughts and concerns to individuals involved. It may be, that they organize getting some food for the family, or something along that lines, that If it is a situation where a memorial is appropriate, that maybe you do some type of candlelight vigil or some type of prayer service or something like that. You want to pay attention to rituals. Rituals are the indication that someone else may be at risk. And so, if you're seeing certain ritualistic behaviors in a group, then you want to really pay close attention to that and intervene with it. And like I said before, you want to pay attention to anniversary dates. So I'm going to talk a little bit about responding to suicidal ideation, threats, or attempts, and then you'll have some more resources on this as well and within the module. Recognize cries for help and ask direct questions. People will make statements about, oh, they're just doing this for attention. Sometimes that may be true, but the attention they need is that I need somebody to understand how badly I'm feeling and how serious this is. Don't beat around the bush. Ask very direct questions. Are you thinking of harming yourself? Have you had thoughts about not wanting to be here anymore? People are afraid that if you ask those questions that you may, give somebody the idea of doing something they hadn't thought about. Typically you don't have somebody that you ask them if they've thought about hurting themselves and they go, oh my gosh, that's a great idea. Why didn't I think of that? You're not going to be suggestive in any way to get somebody to do something they're not already thinking about. In asking the questions, you want to assess the level of lethality by asking questions about, have you thought about what you're going to do? Do you have a plan? Where would you do this? When would you do it? How would you do it? Do you have access to do it? So, if somebody said, I'm going to shoot myself, and then you said, do you have access to a gun? And they said no, that doesn't mean you don't take it seriously. You just know it's a lower level of risk because you don't know at what point they may come up with a different plan. You want to ask them questions about, have they ever attempted before? Anybody in their family ever attempted suicide? Do they have any history of depression? Have they ever been hospitalized before? Have they had mental health treatment before? Are their thoughts and ideas or emotions distorted? Are they not thinking logically? You take all thoughts seriously, even if it doesn't appear that what their plan is, that their risk is high, that if it this appears to be pretty low. For adolescents and children, they are impulsive and they don't understand their own mortality. So they don't know how deep they can cut and still survive. They don't know what pills they could take and how many they could take and still survive. You could take a whole bottle of some prescription meds and all it would do is probably make you sick at your stomach and make you throw up. But you could take 8 Tylenol and die. And so they don't understand those things. So you always want to take it seriously. If you have had any conversation with a student about suicide, you talk to a parent about it. So let's say a friend comes in and said, my friend was talking about killing themselves, and you call them in and the student said, I didn't say that. I was just joking. I was mad. I didn't mean it seriously. And you go, okay, this wasn't real. You still call a parent and have that conversation for a couple of reasons. Number one, you don't know if the student's being honest with you, and you want to make sure that the parent is watching what's going on. Number two, consider that from the perspective of a parent, is that your child comes home and says, the counselor talked to me about hurting myself today. And that counselor has not talked to the parent. As a parent, I would be over the top angry. So you had a conversation about suicide with my child and you did not inform me of what was going on. So if the suicide word comes up at all, you always talk to a parent. There was a story several years ago in Florida about a high school counselor who had talked to a student who had expressed suicidal ideation, and the counselor did not call the parent, and it never really came out as to why she didn't call the parent, but the child committed suicide that night. And so that counselor had a ton of liability issues going on. If I have that conversation, everything stops right there, and I call those parents immediately. You don't want to put it off and risk forgetting to call them. You don't want the possibility, especially with cell phones, you don't want the possibility of that student calling their parent before you do. So you want the parent hearing that from you. There are times, depending upon what the situation is, that with the student in my office that we would call the parents together and put the parent on speakerphone. If you determine that the risk is there and that there's need for additional evaluation, and you're going to have some suicide assessment scales that you can look at that will show you how to, it can actually quantify that. It'll give you numbers to rate the risk. And if you need to ensure that the parents are following up. So the parent has to take the child for a further evaluation. If they do not, or if you think that the risk is great enough, then you may actually have to call CPS or call law enforcement. If the parent doesn't respond appropriately, if they say, "I'll handle it," I don't think that this is serious, we'll just take care of it as a family. Then if they don't get the child help, then you have to call a CPS and make a CPS report. And I would typically give the parents the referral as to where to go, whether a mental health hospital is the best place to go, or the local mental health authority. So in the Nacogdoches area, it would be Burke, or Lufkin area as well. And if they don't go, you need to have some type of assurance that they have gone. They need to provide you with the name of the person that they talked to. They need to provide you with some paperwork showing that they have been there. In some situations when the risk is pretty high, some schools will not allow the student to come back on campus until they have been evaluated. So that puts a little bit more pressure on the parent. And so, I would tell the parent, within 4 hours, I have to have a call from the hospital or wherever you are to ensure that you are there. And if not, then I do have to do a CPS report that's a legal requirement, that as well as an ethical requirement that I have. You can enlist the help of peers with the student permission, but you want to make sure that those peers understand that they have to be working with an adult. That if your friend talks to you about harming themselves, that you have to get an adult involved in that. So if you're going to enlist the help of peers, there has to be a clearly structured protocol for them as to what they're going to be reporting back to an adult. Focus on the student's frustrated needs. What is it that's causing the feelings right now? Like before, you want to expand their time perspective and reframe them by seeing that suicide is a permanent solution to a temporary problem. There are lots of places that they're going to tell you to do a safety plan or a no suicide contract. I'm going to tell you, you can do those things, but they're not worth anything. If I'm going to hurt myself, I'm going to sign whatever no suicide contract you want me to. I'm going to sign whatever suicide safety plan you want me. And there's some new stuff that's come out that has said, if you believe that the risk is great enough to complete a no suicide contract, why are you allowing that student to leave your office or allow that parent to take that student? That if it's serious enough to go to that. So a safety plan is really better than, sometimes it's no suicide, no harm contract. A safety plan just talks about, what are your coping skills? What will you do if you're feeling this way? Who will you call? And so a safety plan is a better idea than a no harm contract. But even with that, you want to be sure that there's close monitoring as to what's going on. And again, you'll get more resources on this later in the module. When looking at referrals, and we talked about this a little bit when you guys did your referral guide, you want to form relationships. You want to share information on the resources that you have. Look at resources within the school. One of the things in making a referral to think about is you always want to provide multiple resources so that parents have a choice. And if you only give them one resource, then it can be said that you were a part of the decision making. And when you're making those resources, or those referrals, consider the family resources. If I don't have insurance, or I don't have a car to get to wherever you're referring me to go to, then consider that. If I do have insurance and the person that you are referring me to is not on my insurance plan, my referral is of no use to me. So a lot of times what I would do is ask parents to bring in their list of providers, and then I would look at that and see if there was anybody on there that I knew. And then you want to establish some type of referral procedures so that if it's forms, if it's at what point do we refer, who are the people that we refer to, but you want to have procedures assigned with that. Okay, so be sure that you're reading the remainder of the information in the module, and we'll look further at crisis intervention within the module.